Hey guys, it's Mitchell. I'm going to talk to you a little bit about the thoracic spine, or the T-spine, as I like to call it. It's an area of your mid-back here. That's where all the magic happens in the golf swing. You know, the best players in the world all rotate with their thoracic spine, and you have this where all the ribs connect. You have a lot of muscles and stuff that connect in there, so a lot of times we lose mobility in that area, especially as we get older. It causes all kinds of swing problems, injuries, and you know, it's not that you can't play good golf with a tight T-spine. You certainly can, and in a lot of cases people find ways to do it extremely well. You know, the problem is they utilize other parts of their body to get the job done, and it's just not efficient. And then they start complaining of injuries, you know, hip injuries, lower back injuries, neck injuries, shoulder injuries, and you know, and a lot of times it's just because they have no movement in their T-spine and they're using other parts of their body. You know, as I talked about in the previous segment, their pattern gets altered and they start having some problems. It can also affect your address position, your posture at address. You sometimes can see a big curvature in the upper back, mid-back, which makes it almost impossible to rotate and keep that same body angle. You know, we all know that the best way to hit the golf ball is to keep our angles. You know, not to be bouncing up and down or losing a lot of our posture. But if I have a tight T-spine, you know, I have no chance of doing that. And what you see a lot of times with somebody that has a tight T-spine is what we call reverse spine angle. It's where when they get to the top of their backswing, their spine or their upper body leans toward the target instead of away from the target at the top of their backswing. That's called a reverse spine angle, and that is the #1 indicator of future back pain or future lower back dysfunction among golfers. So if you're one of those players that gets to the top of their backswing and you see yourself and you're kind of leaning toward the target, you know, you need to get that T-spine assessed and get some treatment and some exercises to correct that before you start having trouble with low back pain or hip pain, whatever. So at the end of this video, I'm going to show you a way that you at home can assess your thoracic spine in 2 minutes to tell whether or not it's where it needs to be. Okay, so stay tuned. Alright guys, hey, this is how you test the T-spine at home, very simply. Take 2 golf clubs, hold them together at 90 degrees, and then set them down in front of you so that it makes an X. Okay, so then you've got 2 45-degree angles. Normal thoracic rotation is 55 degrees. So what you need to do is sit on the edge of a chair, keep your knees together, take the golf club, put it behind your back so that you can't use your shoulder blades. That locks your shoulder blades in place. Keep your knees together and see if you can turn past that 45-degree angle there. Okay, check one side. Check the other side. You should be able to rotate this club past that 45-degree angle. If you can't, you've got a thoracic spine deficit.